Hello, my name's Bea Owens. I'm a physical therapist practicing here in Johnson City, Tennessee. I'm also the current assistant chair and an assistant professor here at East Tennessee State University. I've been practicing as a physical therapist for 21 years, and I've been teaching in the profession for the last 5 years. Several people have asked me why I've gone into physical therapy. As a profession, it's a wonderful profession. You get to build great relationships with your patients, and on a day-to-day basis you can really see that you're making a difference in their lives, you're improving their functional abilities, and you're really helping the patients. So that's what I like about it as a profession. As a career, it's a wonderful career just because of the versatility. You're able to work in so many different settings, and you have so much variety of options that you can choose to practice in the career of physical therapy. Other than just being able to treat variable ages of patients, the other versatility portion of the career of physical therapy is that we can treat in lots of different settings. We do treat a lot in hospitals. That is a huge portion of where our physical therapists practice. So we are seeing patients that have just had surgery. We are seeing patients that have just come in after a traumatic accident. We are seeing newborn infants in the hospital setting. But in addition to that, there are numerous outpatient clinics, and several of those outpatient clinics have specialty areas. We have our sports medicine clinics, we have orthopedic clinics, we have clinics that treat pediatric disorders, specifically those congenital disorders like Down syndrome, other congenital defects and disorders, orthopedic disorders that pediatrics might have, but it's specialized to that area. We have specific geriatric clinics. We have therapists that treat nothing but patients that have arthritis. We have aquatic programs where therapists work with patient in an aquatic pool environment, and that's the environment where they practice their exercises and where they perform their treatments. We also have specific wound care centers where therapists may be doing nothing but treating wounds, burns, other types of wound disorders. We have outpatient clinics where therapists are treating primarily patients that have cardiac and respiratory problems. And then we also have some specialty clinics related to the geriatric population. We have skilled nursing facilities where our primarily geriatric population may have been in an acute care hospital setting, but they're not quite independent enough to be staying at home. And so we will treat them in a transitional clinic called a skilled nursing facility. We also treat in nursing homes, which are more of your long-term care facilities for the elderly population and the indigent population. We have neurological centers where patients that have suffered neurological disorders such as a stroke, a spinal cord injury, head injuries, we have therapists that specialize in that type of treatment, and those can be patients that are living at the facility, and then there are some outpatient clinics as well that patients that have had neurological disorders are able to come in and be treated. And then the last aspect is that we do treat patients in their home. We have some therapists that go individually to the patient's home and provide treatment in that aspect as well. As far as the history of physical therapy, we really started practicing in the late 1800s, early 1900s, and we started out kind of as assistants to the physicians. We were asked at that time to really assist them with treating patients that had polio. That was when the polio epidemic was kind of starting to make its way through Europe and then eventually into the United States in the early 1900s. And that was really how the profession began. We were treating patients that had polio. And then in the early 1900s, during World War I, we were called on even more specifically to help with the rehabilitation of the injured soldiers. And we were really an extension of the physicians at that point. The physicians were not able to handle the volume of patients that were coming through, and so the physicians hired and trained some specific people that they called physical doctors at that point, or doctors of physical therapy, to specifically work on the rehabilitation of those patients. And that was really the beginnings of the profession of physical therapy. We continued along that line through several different wars, working with the physicians as well as working through the polio epidemic. And then in the 1950s, we really started to formalize ourselves as a separate profession and formalize the education process needed to be a physical therapist. And at that point, we started looking at what type of education is needed. And we developed specific courses and training that therapists needed to take, and then we developed a formalized licensing examination that in order to practice you had to take that licensing exam and pass that at a certain level. And that was really the foundational beginnings of physical therapy as a career as we know it today. So we started separating ourselves from the physicians and becoming more of our own profession in the early 1950s. We kind of continued along that course until the 1990s, and at that point we really saw a need to further the profession even more. And at that point we started discussing what do we need to do to better ourselves as a profession. And at that time the required education to become a therapist was fairly limited. We needed a bachelor's degree, so 4 years of training. Which 2 years of that was general pre-medical prerequisites, and then 2 years of intensive physical therapy training. And then that was followed by a national licensing exam that you had to score a proficient amount on. And in the 1990s we looked at, we probably need to increase the level of education because there are a lot of new diseases, new processes out there that we are handling and are expected to be able to handle. And so at that point they looked at changing the level of education, and it changed quickly to a master's degree, and then prior to the year 2000 it has been changed primarily to a doctorate degree. It's been mandated by the year 2020 all practicing physical therapists will hold a doctorate level degree. So at this point over 95% of the educational facilities that train physical therapists are training them at a doctorate level. There are almost 300 physical therapy schools in the United States, and less than 10 of those are currently at a master's level. The remainder are at a doctorate level. So the education of physical therapy has progressed a lot through the ages. The requirement for practice is that you have to have graduated from an accredited physical therapy program. At this point most of those are at a doctorate level, and then we're still required to pass the licensing exam. And right now the requirements for that is that you pass at a level roughly equivalent to 75% competency on that multiple choice exam. There are a few states that still implement the need for a clinical portion of the exam where you have to go in and exhibit or give examples of how you would specifically perform with a patient. But the majority of the licensing examination is a multiple choice standardized exam. The current versatility with the profession of physical therapy, as I said, is one of the things that I really like about the profession. We work across the lifespan. We work with newborn infants, especially those that are born early. We work with facilitating normal development with those children. We work with children through all ages. We work with sports teams. We work with athletes during their teens and early 20s and on through their athletic careers. We work with adults. We work with elderly adults up into the geriatric population. So we're definitely versatile as far as the age span that we work with. The profession of physical therapy is also very versatile in the types of disorders that we work with. We work with congenital disorders, people that are born with disorders. We work with neurological disorders, patients that have had strokes or cerebral vascular accidents, patients that have had spinal cord injuries, patients that have had head injuries. We work with orthopedic disorders, including sports injuries, fractures, multiple traumas after a car accident, all sorts of orthopedic type disorders. There are specializations within lots of those areas. If you want to work specifically with just one type of patient or one patient age, you can specialize enough to do that. We also work with cardiac patients, patients that have had heart problems, patients that have lung and respiratory problems. We work in wound care, so there's just quite a bit of versatility. It's never boring. Anytime you think you've mastered one area of physical therapy, there are lots of others that you can branch out to if you're starting to get a little bit bored. So it's great with the versatility. Currently, with the educational process, our prerequisites, because it is a doctorate level program, to get into our program, you're required to have a bachelor's degree. We often get asked, what is the best bachelor's degree to pursue if we're interested in pursuing a degree in physical therapy? And there really isn't a set answer to that. You can pursue and finish any type of bachelor's degree that you prefer. We've had students that have come through our program that have had degrees in English, psychology, biology, exercise science, music. It can be any level of bachelor's degree that you choose. However, within that bachelor's degree, or in addition to the bachelor's degree, if those courses were not included, there are some specific pre-medical type courses that are required to apply to the physical therapy program. We do require 2 semesters of biology, 2 semesters of chemistry, 2 semesters of physics, a course in exercise physiology and or biomechanics, kinesiology. We require a course in 2 courses in psychology, and then the 1 course in statistics. And then the remainder of your courses can be any level of versatility that you prefer. So there's quite a bit of versatility within the degrees that you can bring into the field. And we really kind of encourage that versatility. The profession of physical therapy has been discussed as being the art and science of healing. And I truly believe it is a good combination of those 2 aspects. Most people tend to think that a science background is the best background to have as far as getting into physical therapy, but that's not always necessarily true. We do have to have a good understanding of the science behind what we do, but there's definitely an art to the healing side of physical therapy. And we have to be able to relate to patients on lots of different levels. So in many cases, it's advantageous to have your undergraduate degree in an area that interests you. If you're interested in music, or you're interested in psychology, you're interested in theater, whatever your background and interests are, those are the things that you're going to talk about with your patients, and those are the ways you're going to make those bonds with your patients. You can understand the science, but you still have to have that art of being able to have a relationship with your patient to make a difference for them. Once you have completed those prerequisites, then you would make an application to our program or to any program in the United States. And the majority of the programs have a similar list of prerequisite courses. Some programs do require that you have had some experience in physical therapy prior to applying for the PT program. We do not have a specific number of hours that we require that you have volunteered or worked in a physical therapy clinic. We do encourage our students that are applying to physical therapy school to spend some time in a clinic before they make a decision about the career. That's the best way to really find out if it's something you're interested in, is to go into a clinic and observe, talk with people that are in the profession, get one-on-one with the therapists that are working with the patients, and start talking with the patients. Find out, are you going to be able to relate to the patients? Am I going to be able to build those relationships and bonds that I need to be successful? And really getting into a variety of different clinical settings is a good way to find out if this is what you really want to do. Once you've made your application, finished your prerequisite courses, then you're called in for an interview. This is another point in time where your versatility and variability as a person is a plus. When you're interviewing for a position, we don't just want to know that you know the basic science and you can get through the program. We also want to know that you can relate one-on-one. You can have a good conversation. because again, that's part of the art of our profession. And so those are some of the things that we pull out within that interview. Once you're accepted into the program, and it is a very competitive program, but once you're accepted into the program, the coursework is fairly rigid. We have a 3-year program. Our students are generally in class an average of 6 to 8 hours a day. I would say an average of 6 hours a day, 5 days a week for the entire 3 years. They are given a couple of weeks of vacation between semesters, but it's a pretty rigorous program. The first year is a lot of the basics. It's a little bit more coursework than it is clinical work because we're setting foundations for what you need to know. And this is when we do a lot of our background on the basic science, your general anatomy, your physiology, your pathophysiology, all of your basic sciences of how to do an evaluation, and starting to figure out what those evaluation measures mean. We do think it's important for our students to be in the clinic throughout the entire course of the 3 years. So our students are starting in the clinic from the very first year. At the end of the middle of their second semester of classes, they start in the clinic. And we think that's a great time. They've started with that foundational background, and it's a good time to get in the clinic and start practicing, starting to implement those new things that they've learned. So the first year is a little bit more on the academic side, a little bit less on the clinical side, but there is a mix of the two. Second year, we start looking more at our specific types of physical therapy. We start learning the specifics about wound care, about cardiopulmonary, about orthopedic treatments, about neurological treatments. And that year is about a half and half mixture of coursework and clinical time. And then third year, we start really refining and fine-tuning the things that they've learned. We have a course called differential diagnosis where the students are learning to clearly differentiate things that look very similar to each other, and really starting to fine-tune things. That's when they have their administration classes and really starting to look at the broad scope of physical therapy. In the third year, they spend more time in the clinic than they do in the classroom. And at the end of those 3 years, they will hopefully graduate from our university, which is accredited with the American Physical Therapy Association, and then they're eligible to sit for their licensure exam. The licensure exam is a 300-question exam. They're given 6 hours to take the exam. And again, it's a fairly rigorous, all-encompassing type of exam that covers everything they've been taught. And so they are required to prove their competency and proficiency on that exam prior to being able to practice. As far as the projections about the career of physical therapy, right now healthcare is a little uncertain. We're not quite sure what all the changes in healthcare are going to bring about as far as the profession of physical therapy. Some projections are very, very favorable toward physical therapy, that we may possibly even be called upon to expand out even further than we are currently. As I said, one of the courses that we are implementing with our students now is differential diagnosis. They're also trained in how to read x-rays and MRIs, things that have traditionally in the past been reserved for the physicians. But because we are moving kind of to a new level with physical therapy in an area called direct access, we feel like it's important for our therapists to be able to differentially diagnose and specifically know what's going on with the patient. With the movement toward direct access, what that means is that we are allowed as a therapist to see a patient without them having been seen by their physician. In the past, we have traditionally been a referral-based profession in that prior to coming to physical therapist, a patient would have had to go to their physician. The physician had already screened them for all other disorders, given them a specific diagnosis, and determined that physical therapy was appropriate. As we've moved to a doctorate level, we are now starting to see patients without them having seen their physician. So in doing that, it has put new responsibilities on us that we are now responsible for differentiating out if they have any other disorders that might be causing their current symptoms that aren't musculoskeletal, things that we would not be treating in physical therapy. things that they need to go to a primary care physician for, or that they need to go to an oncologist, they need to go to another specialist that's outside our scope of practice. And so because we have moved to a doctorate level, there are some projections that we will become similar to a primary care physician in that patients will come into us if they are having pain, if they are having difficulty moving, if they are having classic signs and symptoms that in the past have been treated with physical therapy. And it will be up to us to screen them and decide if they are appropriate for physical therapy, or if it's necessary that there are some other medical tests that need to be done and they need to be sent to a medical professional or a specialist. So there's some projections that we will be even busier as a profession and have even more responsibility. If we stay in the same capacity that we are now, which is, seeing patients that are referred to us primarily from a physician, there are still projections that we're going to be hugely necessary in the next 50 years. Because of the increasing age of the overall population, there's a huge percentage of our population that is currently over the age of 50. And as they are continuing to age, there are many, many disorders that we treat in physical therapy. We treat arthritic disorders. We treat patients that have required to have hip replacements, knee replacements. As our bodies deteriorate, there's just more pain, and those are things that we can treat in physical therapy. Additionally, our health habits have not been great. And so there are a lot of disorders that are more prevalent now than they used to be. Diabetes is much more prevalent. Heart problems are much more prevalent. Respiratory disorders are more prevalent. And those are all areas that we can treat and address in physical therapy. So projected longevity and security of the profession of physical therapy is very high for multiple reasons. In closing, there are a lot of people that ask me why I have gone into teaching. If I love the profession of physical therapy so much and I love treating patients so much, then why have I decided to go into teaching? And the main reason that I decided to go into teaching is because I love the profession of physical therapy so much. I'm very passionate about the profession. I love what I do. I love the versatility. I love the one-on-one relationships that you build with those patients, and I love the fact that you can make a difference in someone's life. And because I love that so much, I think being able to teach other people to do the profession that I love is a normal progression. I love being able to teach other people to enjoy a profession that I enjoy so much. So I want to say good luck with your career choices, and I thank you for considering physical therapy as one of those possible options, and I hope you do great with whatever you choose. Thank you.